Hey guys, it's Dr. E with ManualTherapist.com. A reader asked a question. He's a former musculoskeletal PT, outpatient orthopedic, and now he's in acute care, and he's been seeing a lot of emergency room or emergent care patients, mostly for mobility reasons. So on a chart review, a guy came in with less than 48 hours duration of acute low back pain. He has a positive MRI, which shows some annular fissures and some other minimal findings. So he said, is it too easy to work him into extension? That's the question. So basically, my answer is, and I always get excited when someone comes in 48 hours. It is rare for many practices that don't utilize direct access to have a patient who coming in so early with acute onset like that. Normally they go through the rounds and they see their primary who tells them to go to bed rest, puts them on meds, then they get an x-ray or an MRI, then they go to a specialist, and by the time we see them, we've lost that acute care window. So when it's acute, it's the easiest to treat, and that's backed up by a lot of data from the McKenzie Institute and also from our CPRs for both the cervical and the lumbar spine. Within that 2-week time frame is the time when it's easy to treat. And I always tell my patients, even if they flare up, great, because rapid onset to me means rapid resolution. So is it too early to work him into extension? Absolutely not. He may be in acute pain and unwilling to move, absolutely. Is it too early to work him into prone extension? Absolutely not. He will have a directional preference, 80 to 90% or so have a directional preference, especially in the early stages. So you may need to start him prone over 2 pillows for 5 minutes or so, then prone over 1 pillow, then prone on elbows, then try to get him into press-ups. There'll be if it's unilateral, if it's one-sided more than the other, you might need to do a modified hip soft up position, which we call the roadkill, which is like that figure 4 position. I'll post a picture of it on my blog, and I did last week as well. Or you may need to do hip soft sets. But either way, it is the easiest time to treat them when they're acute, and absolutely do not be afraid to get them to move, because movement is the best thing for them, as long as it's in the directional preference, which is going to relieve and alleviate his complaints.